Okay, today's our topic is concept of evidence-based medicine and integrative medicine. Okay, this topic is present in class BMS third phase, first chapter, third topic. Okay, in this class we will study two topics. That is, one is the EBM, evidence-based medicine, and next one is the integrative medicine. Two topics we will study in today's class. Okay, the first topic is evidence based medicine. In short, it is called EBM. Okay, in university examination, so many times it is asked, write about EBM like that. Okay, first of all, we will study the EBM. Okay, what is evidence? Okay, evidence is that after the research, after the clinical research, something is proved. Okay, something is the proved one that this drug is effective. Okay, this medicine is effective. After that only we are giving to the patients. Okay, this is the based on the evidence only the drugs we are selecting. This is the evidence based medicine. Here the first thing is the definition. We will study here the definition. The definition is that it is the use of current best scientific evidence combined with the clinical expertise and patient preference to guide medical decision. Okay, what it means? To giving the patients the medicines, so what are the three criteria we are following here? The first one, that medicine should be evidence based. Okay, the current best scientific evidence after the clinical trials. Okay, after the peer reviewed only, that medicines only we are taking. Okay, for the patients. And second one, after that, this is alone we are not following. We are along with that the expert in that subject or expert in that field. Okay, the physicians, that we are taking the advice. Okay, the clinical expertise. Next one, based on the patient preference. Okay, patient preference, the patient, what the patient want. Okay, whether the patient want any specific methods, injection form, tablets form, or any other form. Along with that, in Ayurveda, that is the based on different prakriti, based on the patient preference, we are giving the patients, we are giving the medicines. This is called as a EBM, evidence based medicines. Nothing but the evidence medicines only giving. The previously you may heard about the so many drugs we are giving based on our teachers told, based on our seniors told, like that we are giving the medicines. But nowadays this term EBM is that supporting to the only evidence-based medicines only we have to give to the patients. Okay, the three objectives are there here. Four objectives are there of the EBM. The first one, to improve the quality and safety of care. Okay, why this EBM is came? Because improve quality and safety of care. So first of all, the drug quality should be improved. Okay, the previously whatever the drug it is there, improve the quality. Next one, safety and care, safety of the patient. Next one is the provide scientific proven treatment only, to give the only scientific treatment proved only. Okay, the third one, avoids the outdated practices. The previously whatever the resistant drugs are there, the drugs which are having so many adverse side effects, that should be avoid and outdated. Those are not acting, those should be outdated. Avoid that one and try to give this evidence based medicines. Okay, this is the third objective. Next, fourth is offer personalized patient cares. Okay, specific drugs are acting on specific patients. That is in prakriti, according to prakriti only we have to select the patient. These are the objectives of EBM. Okay, now the how we have to select the EBM, evidence based medicines, the steps of the in the practices. Okay, first thing is the we have, whenever we are planning to give the EBM evidence based medicines, the first step is ask to the patients, that is formulate the clinical questions. Okay, formulate the clinical questions, the ask the all the symptoms, whatever the symptoms are there, that we have to ask. Okay, after that the second step is search for evidence, that we have to correlate with, that is whatever the symptoms are there, that we have to correlate which one is the best scientific evidence medicines that will cure these symptoms. These are the second steps. Third one, the appraise the evidence. Here the appraise evidence is nothing but evaluate based on the clinical expertise whether the drugs is only that it is told in the research papers only, or it is actually really in the real life it is acting. That after that you have to evaluate. Lastly, the next one, in the 4 steps we have to give to the patients or apply in the practice. Last step is after the practice, the last step is evaluate the whatever the outcome it is there. Okay, what happened after the, if you are given the treatment, okay, whatever the outcome it is there, that you have to evaluate. Okay, these are the steps in the EBM. Okay, now the example, we will take very good example, Ashwagandha. You may heard about the, for the stress management as well as anxiety, the Ashwagandha is one of the choice of the drugs that is told our Acharya's ancestors. Okay, but previously there is no scientific evidence is there. Okay, nowadays after the clinical trial it is proved that the Ashwagandha, Withenia somnifera, is one of the best drug for the treating of the anxiety as well as stress. Okay, it is concluded that the Ashwagandha is one of the best drug. Okay, based on that the treatment we can give. Okay, this is about the EBM. Okay, the next second topic in today's class is the integrative medicines. Okay, what is integrative? Integration means adding, combining. Okay, what is here adding and combining? Integrative medicines. The medicines, instead of giving the only the modern medicines or allopathy medicines, we have to add some Ayurvedic medicines, yogas or Unanis in that. Okay, that is called as a integration or combining the medicines. Okay, so many diseases you may heard about the so many diseases that is not treating with the alone modern medicines. In that cases, or chronic diseases that is not treating with the allopathic medicines. Okay, in that cases we have to select the that is a combined medicines, that is called as a integrative medicines. Along with the modern medicines, we can integrate with the Ayurveda or yoga or some other traditional medicines also we can add here. The main intention behind this integrative medicine is not the only physical treatment or physically curing. The main intention behind is the physical, mental as well as the spiritual well-beings. Okay, that is the main uddesh of the Ayurveda. Okay, Sharira, Manasika and Atma also the Swastha. Okay, that is that we have to follow. That is the main goal of this integrative medicine, is the body, mind and spiritual. Okay, what is the definition? It that it combines the modern medicines with traditional system like Ayurveda and yoga to treat whole persons, body, mind and spirit. Okay, you know the modern medicines only externally, the physically only they're treating. Okay, the integrative medicines is the much more better than that the allopathy medicines. Okay, the intention is that the treating whole things. Okay, this is about the definition. Now what are the principle, on what principle it stand the integrative medicine? The first is the holistic and patient centered. Okay, what is holistic? Holistic is nothing but whole, that is the body, mind as well as spiritual level, whole level we want to treat. Okay, that is the holistic, as well as the concentrating on the patients, the individual patients we have to concentrate. Based on the that only we have to select the medicines and giving. This is the main principle of the integrative medicines. The next one is the focus on wellness as well as preventions. Okay, the second principle, it means that the wellness is nothing but the treatment. Okay, the patient is suffering, that we have to treat the patient. That is the focus on the wellness as well as the prevention also. Okay, in Ayurveda it is the swasthasya swastha rakshana aturasya vikara prashamana, that also we have to focus. This is the second principle in the integrative medicines. The third one, the use safe and evidence based medicine therapies only. Okay, the integrative main medicines, the principle is that using safe medicines and evidence-based medicine therapies only we have to use. Okay, the next one is the principle is the respect the culture and personal use. Okay, whatever the cultures are there, that also we have to follow. You know, that is the traditional medicines. So many you may heard about that. Okay, while where they are suffering from that jaundice and so many renal calculi, in that cases they along with that modern medicines, some that is folklore medicines also they are taking. This is the integrating the medicines. You may see that there is a one of the very good results in that. Okay, this is the respect cultural as well as personal values also. This is the integrative medicine principle. Okay, the next one is the what is the importance here. Okay, importance of the this integrative medicine is effective in chronic and lifestyle diseases. Okay, you may heard about the chronic diseases are not treating with the modern medicines. In that cases, the this importance is this integrative medicine is the integrating with the modern as well as the traditional medicines, that is the effective in chronic as well as the lifestyle disorders. Next one, minimizing the side effect. The main important thing is that you may heard about the so many chemicals. Due to that, the adverse effects are very common, side effects are very common. Okay, to minimize this one, the integrative medicines, the aim is that. Okay, the next one, improve the quality of life and treatment outcome. Okay, you may heard about that due to so many NSAIDs, so many medicines, that the patients that feel something, that is a dizziness, or patient is not fully satisfied. Okay, some adverse effect or some patient is not feeling better. To avoid that one also, to improve the life, improve the quality of life as well as treatment outcome. That's why also integrative medicines we can select. We have to select. Example, very good example. It is there. Osteoarthritis, Sandhivata. Okay, Sandhivata. You know that is a very commonly the modern doctors we are giving the NSAIDs. Okay, like aceclofenac, diclofenac, ibuprofen. So many medicines the NSAIDs we are giving. Okay, instead of giving the alone NSAIDs or physiotherapy, if you will integrate, if you will add the Ayurveda as well as yoga, we can see the better result. That is Abhyanga, Rasana Saptaka Kashaya, Basti. This combined approach offer better pain relief and mobility. Okay, this is about the integrative medicines. Okay, now come to the conclusions. Okay, here we will conclude that the why this EBM and integrative medicine, it is the main role here. The EBM ensure the scientific accuracy. Okay, it means scientifically accuracy. Based on the accuracy we are giving the EBM, evidence based medicines. And while the integrative medicines promote the holistic, whole body, mind as well as spiritual, the combining the both leads to the main intention is the safe. Okay, that is the safe, effective and the patient centered care. This is the main three goals are there by using these EBM as well as integrative medicines. Okay, this is about the this topic concept of evidence based medicine and integrative medicines. Okay, the notes are available in the that is the in the comment sections as well as in your descriptions. Please go through the notes. Okay, if you like this video, please like, share and subscribe. Thank you.